Okay, thank you all for joining us today. We appreciate your time. Again, if you have a question or would like record access, please indicate so in the chat. Otherwise, we are going to go ahead and begin. Dr. Vanderhoff.
Well, thank you very much. Good morning. I am Dr. Bruce Vanderhoff from the Ohio Department of Health. I want to thank you for joining us today. As you may have heard yesterday, Governor DeWine announced my appointment as director of the Ohio Department of Health. During the past several months in my role as chief medical officer, I've witnessed firsthand the remarkable focus and dedication of the Ohio Department of Health staff, and have witnessed the profound impact of their efforts on our battle to end this pandemic and to advance the health and well-being of Ohioans through numerous public health programs. I'm confident that we will together continue to build a public health system that can serve as a model across the nation. I want to thank Director McLeod for her sacrifices and her leadership, for stepping into this role during an historic crisis. Her leadership has been indispensable in our department's service to the state, and I'm exceptionally proud to be a part of the Ohio Department of Health team and now to be appointed as its new director. Turning now to COVID-19, we're continuing to see a troubling increase in COVID-19 cases statewide, with more than 2,300 new cases reported yesterday alone, as well as a sharp increase in our case rates per 100,000 residents, which is rapidly climbing toward 200 after having been as low as just 17.6 cases per 100,000 residents. That was on July 7th of this year, so a very short time ago. Now, we'll be adding case rates over time, which for many months were archived as a part of the Ohio Public Health Advisory System, to the website today to make it easier for you to track these numbers as well. Now, we're also seeing an increase in hospitalizations, ICU admissions, and in ventilator use. And as you can imagine, these are in use not just by COVID-19 patients, but by patients with many other diagnoses as well. Now, while we have substantial hospital and ventilator capacity remaining here in Ohio, we nevertheless have heightened concern as reports emerge from other states that hospitals there are beginning to turn away elective procedures and face real pressure on their physical resources. We don't want to see our hospitals here in Ohio facing such a scenario, and continue to remind Ohioans that the best way to protect yourself from serious illness with COVID-19 is choosing to receive a vaccine. The increases in cases and hospitalizations, of course, can largely be attributed to the Delta variant, which is now fully dominant in Ohio. We're able to monitor the Delta variant through genomic sequencing, which is conducted on PCR tests with enough sample remaining after those are run and a high enough viral load that then we can subsequently genomically sequence them. Now, it's a complex process, and as I've described before, it can take 3 to 4 weeks for us to get results. So there is some data lag. However, for the most recent available period of July 18th to the 31st, the Delta variant and its sublineages have made up nearly all of the samples sequenced. That means we can safely assume that any case we're currently seeing in Ohio is almost certainly the result of the Delta variant. The Delta variant is much more contagious than previous variants, so much so that COVID-19 is now more contagious than the common cold or the flu. The Delta variant also appears to be more dangerous than prior variants. We now have data from Canada and Scotland showing that those infected with the Delta variant have a higher likelihood of needing hospitalization, and from Singapore, that there may even be more risk of pneumonia, ICU admission, or death. Finally, it appears that the Delta variant may produce a significantly higher viral load than was seen with previous strains, meaning it makes patients sicker quicker. Nevertheless, the COVID-19 vaccines continue to provide outstanding protection that makes it highly unlikely that a vaccinated person will end up in the hospital or will die from COVID-19. Although daily vaccination rates aren't what they were at their peak, we're encouraged by a recent upward trend that we've noticed among those starting the vaccination process each day. In recent days, we've seen more than 10,000 Ohioans choosing to start the vaccination process daily, and another 5,000 or more completing their vaccine series. This is all movement in the right direction. Statewide, we have more than 50% of Ohioans of all ages and more than 60% of our adults who have started the vaccination process. This is so important because COVID-19 vaccines provide the best protection from severe cases of COVID, including hospitalization or death, and they can help prevent dangerous variants from taking hold. We continue to encourage all eligible Ohioans to choose to be vaccinated. Now, we know that vaccine hesitancy remains, and that may be for a number of reasons. Some people are concerned about vaccine side effects. Some are worried about the vaccine's safety. Others are waiting for full FDA approval. And some have just decided to wait and see. First, for those who are concerned about side effects, please remember that no medicine is without risks of side effects, including COVID-19 vaccines. But it's important to know that many people have no side effects from the vaccine at all, and that for the most part, side effects tend to be mild and short in duration and similar to those seen with other vaccines. And these include pain, redness, or swelling at the injection site. Throughout your body, you might experience tiredness, headache, muscle pain, chills, fever, or nausea. Rare individuals may experience a severe allergic reaction, which comes on quickly and is very treatable. There have also been rare reports of myocarditis with the mRNA vaccines, but again, most of these patients respond well to treatment and rest. And of course, with the Johnson & Johnson vaccine, there have been rare instances of a serious clotting disorder known as TTS. But for the vast majority of people, getting a COVID-19 vaccine isn't a lot different than getting many of our other vaccines with side effects that tend to be both mild and short. Now, compare that with the long-term effects of COVID-19. The most severe and irreversible complication, of course, is death. Right now, more than 99% of all COVID deaths in Ohio have been among those who aren't fully vaccinated. Likewise, it can make people of all ages very sick. That is, COVID can make people very sick, landing them in the hospital or the ICU. And more than 98% of our hospitalizations for COVID have been among those who have not been fully vaccinated. Getting the COVID-19 vaccine is simply your best protection from both hospitalization and death. But problems with COVID can last long beyond your initial infection. COVID-19 can cause severe inflammation of blood vessels and organs. And so for some COVID survivors, there can be long-term damage to the lungs, heart, kidney, brain, other organs, and it can also cause blood clots and blood vessel problems. There are also long haulers, patients who report lasting symptoms for months after they test positive for COVID. These symptoms include difficulty breathing or shortness of breath, tiredness, fatigue, brain fog, difficulty concentrating, lasting cough, chest pain, stomach pain, and the list goes on. And some people report that it takes quite some time for their loss of taste or smell even to return. Bottom line is that today, COVID-19 is essentially a vaccine-preventable illness with vaccines that are both very effective and very safe, which leads me to my next point. We know that people have questions about the safety of the COVID-19 vaccines, especially because they are so new. I first want to note that while indeed these vaccines were brought to us remarkably fast, it wasn't corners that were cut, but red tape. Clinical trials for these COVID-19 vaccines started in March of 2020, just as the World Health Organization was declaring COVID-19 a global pandemic. All the normal safety steps were taken, just like they have been in the past for vaccines we've come to rely on, like those preventing polio, measles, mumps, and whooping cough. But this time, without long delays between stages due to bureaucracy or due to the need to mitigate business risks. And now, for months following FDA authorization, these vaccines have been closely monitored by the world's most comprehensive vaccine safety program. As a result, with more than 352 million doses administered in the United States, we have a staggering volume of clinical and safety data, showing that serious reactions after receiving the vaccines are incredibly rare. And indeed, the reason we know about these reactions and how to treat them, like the cases of TTS, or myocarditis I mentioned earlier, is precisely because of these safety monitoring systems. Now, the most prevalent vaccine safety monitoring program is the CDC's VAERS, or VAERS system, which stands for the Vaccine Adverse Event Reporting System. Any individual, not just a medical professional, can submit reports to VAERS. That means a report could be submitted by a patient who received a vaccine, a family member, a doctor, a vaccine provider, anyone. These reports are then able to be reviewed for trends and investigated by the CDC. Another important program is the CDC's VSafe program, launched in December when the COVID-19 vaccines first became available. This is smartphone-based. It's a post-vaccination health checker that uses text messaging and web surveys to check in with vaccine recipients for health problems following vaccination. The system also provides telephone follow-up to anyone who reports medically significant adverse events. In addition, those who use VSafe can use it to look up their vaccine information. And while it isn't intended to serve as an official record of being vaccinated against COVID-19, it certainly can be used to retrieve relevant information. The CDC has several other safety monitoring programs that are integrated with VAERS. The NHSN, or National Health Safety Network, the Vaccine Safety Data Link, and the Clinical Immunization Safety Assessment Project, or CISA. The FDA and the Centers for Medicare and Medicaid Services, CMS, also monitor systems, including claims-based databases for large insurers and for Medicare. Bottom line is, there are numerous layered safety systems in our country which closely monitor the vaccines and their safety. Finally, to those who've been choosing a wait-and-see approach, I want to remind you that COVID-19 isn't the common cold, but a nasty virus with potential for serious consequences. I continue to hear heart-wrenching stories about those who are hospitalized or have died, who could have been vaccinated but weren't. Hearing stories from someone's deathbed wishing they'd been vaccinated is, of course, heartbreaking for that individual, but it's also particularly difficult for their family and loved ones and the frontline healthcare providers who are doing their best to save that person's life. Vaccines save lives, and getting the COVID-19 could be what keeps you out of the hospital. If you are getting a 2-dose vaccine, remember, it takes 5 to 6 weeks to be fully protected. First dose, second dose 2 to 3 weeks later, and then full protection 2 weeks after that. With fall and cooler weather right around the corner, Now is the time to make the choice to be vaccinated. Now, joining me today to share frontline experience of what doctors and nurses are seeing every day in our hospitals is Dr. Stephen Burdette, Chief of Infectious Disease at Wright State University. Dr. Burdette, as an infectious disease expert caring for patients sick with COVID-19 in the ICU, you give guidance to those ICU doctors on how to treat patients. What are you currently seeing in the hospital in terms of vaccinated versus unvaccinated patients? And what can you tell us about the patients that are doing poorly? Are there any trends among them? Are they vaccinated or unvaccinated? Do they have underlying conditions?
Yeah, thanks, Dr. Vanderhoff, and thank you for the opportunity to share some of my experiences here at Miami Valley Hospital. Just to put this into perspective, in November, December, when we were managing COVID patients, they were nursing home-based patients, they were elderly patients. It was a geriatrics service because that was the population that was greatly affected with that wave. Now that we are 18 months into this almost, our current issues are very different. So number one, it is almost exclusively our sick patients are unvaccinated. We do see an occasional vaccinated patient. In general, they are on low amounts of oxygen. They might be here for other issues and happen to test positive, but our vaccinated patients in general are minimally to no symptomatic and doing very well and stable from a COVID standpoint. Our COVID intensive care unit is full of patients who are unvaccinated. I mentioned last year how it was a geriatric service. It is no longer the case. We do not have nursing home patients to any great degree. We occasionally have a nursing home patient, but back then we had units of nursing home patients with COVID. And now we have an occasional one, but we have younger patients. I was looking at the years of birth and of our patients, and we've got patients born in after 2000, several born after the 90s, several born in the 80s, a whole bunch born in the 70s. And that is very different than what we were seeing before. So we're seeing younger people, and many of them don't have a reason to. This is not young people with cancer. This is not young people with HIV. This is young people who were working, in a factory 2-3 weeks ago before they got COVID. The one risk factor that we consistently see is obesity. Many of our younger patients that are critically ill are overweight. And that appears to be, in the literature since day one, has been very consistent with that. But if you are an unvaccinated, overweight young person and you get COVID, you have a very significant chance of having a very complicated course and potentially a bad outcome. So very different from what we were seeing early on in the pandemic.
That's very, very interesting and important. Can you tell us a little bit more about these young adult patients? Are they being spared the kind of severe illness that some of the older patients have experienced? And are you seeing anything new in terms of the clinical picture for them?
So it's gone back to how we saw kind of early on in the disease, where this infection is unlike anything else that I've dealt with. I've been an infectious disease doctor for almost 17 years now. And we would see patients with various bacteria who would gradually get worse. Sometimes they would suddenly get worse, but that was not very common. Patients with significant COVID will be doing okay. And then within 3 to 4 hours, they will be on max amounts of oxygen and you'll have to put them on a ventilator. It is a very rapid decompensation that you can't necessarily predict who it's going to happen to. And that is happening in the young people. A year ago, it was happening in our nursing home patients, and now it's happening to the young people. It is one thing that's a little different than what we saw before is we don't see the amount of kidney failure with this current strain or with this current process like we had last year. Last year, we would have, entire units basically on dialysis because the virus would affect the kidneys. But now, because this is impacting younger, healthier patients who have younger and healthier kidneys, their bodies, their kidneys at least, are able to absorb the damage and the inflammation from the COVID, but their lungs are not. And the thing is, if you are young and healthy, even if you get bad COVID and it affects your lungs and you go on a ventilator, your chances of coming off the ventilator, unfortunately, are not good. And that's despite us doing everything that we can. With bacteria, with staph infections, with MRSA, I have antibiotics to take care of that. I have things that are going to treat that infection and get you better. With COVID, I don't have anything that's magic that's going to guarantee that you're going to get better. A lot of it just depends on how your body is going to respond. So this is very different. And I want to emphasize to folks, this is very different than getting a bacterial pneumonia. This is very different than influenza. I don't have anything that's going to that is going to make sure everybody gets better from this. If I have somebody with a MRSA, a staph infection, pretty much all of them are going to get better. Not 100%, but almost all of them respond to therapy. Not the case with COVID. The best way that we can keep people safe is to prevent them from getting COVID. And the best way to do that, far and away, is with vaccination.
So let me take that a step further. As I shared earlier, Dr. Burdette, we continue to hear from people who are genuinely worried about potential side effects of the vaccine. And in my comments, I compared those side effects to the potential impacts of COVID-19. But as somebody who has seen and continues to see patients suffering in the hospital with COVID, what would you say to someone who has those concerns about that calculus between being vaccinated versus the risks that they're worried about?
Yeah, so I understand that. I get it. Studies have now come out looking at patients' risk for having a side effect from the vaccine versus their risk from having complications from COVID. And the literature now supports that somebody's risk of complications of COVID, between the long haul, between the respiratory issues and the other problems, is greater than the complications of the vaccine. We here at Miami Valley Hospital are level 1 trauma. And we take referrals from all over Southwest Ohio. And if we were seeing patients dying of the COVID vaccine, I'm pretty sure they would have been in our facility and my team would have been involved. We didn't see that. Yet almost every day, if not right now, every week, we have people dying of COVID. So I understand that people are worried about it, but you went over the numbers. This is now the most, in my opinion, the most studied therapeutic in the history of medicine. There's no antibiotic. There's nothing else in infectious diseases that we study millions and millions of people with and track their adverse reactions and monitor for that. And so, yes, maybe we haven't published data. It's not officially FDA approved, but nothing has been more scrutinized than the COVID vaccine. And we don't see issues like that from the COVID vaccine. We see occasional side effects. Some people do have some long-term issues with the vaccine, but for every one of those, there are dozens and dozens and dozens of people who have had side effects from actually getting COVID.
Thank you, Dr. Burdette, very much. Well, COVID-19 is, as we know, a global pandemic, and it has killed, sadly, more than 600,000 Americans, including more than 20,000 Ohioans. Thankfully, for many, severe COVID is now a vaccine-preventable illness, as both Dr. Burdette and I have described. Vaccines are simply our best protection against this virus, and Ohioans age 12 and older can make the choice to receive that protection by getting the COVID-19 vaccine, which is readily available across our state. If you have not yet gotten vaccinated, please know that the Delta variant is extremely contagious and can land even in young, vaccinated people, can land them in the hospital. So with that, I think Dr. Burdette and I would be happy to open it up for questions.
Thank you, Dr. Vanderhoff. Our first question comes from Laura Hancock with Cleveland.com.
Hi, Dr. Vanderhoff. We just got, while you were talking, an email from a Republican in the Ohio House is going to sponsor a bill. He's looking for co-sponsors right now to prohibit schools in Ohio from mandating that students wear masks. Do you think this is wise?
Well, the Ohio Department of Health has repeatedly now offered guidance for what we believe to offer the safest options for parents and for schools in terms of protecting students from COVID-19. Our best recommendation is, and this is again, a guidance that we are really putting in front of parents. Our best recommendation is that you get vaccinated if you're eligible. So if you're a student who's eligible, parents should have that child vaccinated. If they choose not to, or if they are not eligible for receiving the vaccine, it is our best recommendation that those students wear a mask to reduce transmission, to reduce their risk and the risk to others. We, as a Department of Health, have though been consistent in offering this advice without mandating that people receive the vaccine. I think that that's our best role, is to provide good medical guidance to the public.
Thank you, Dr. Vanderhoff. Our next question is from Kevin Landers with WBNS 10.
Hello, Dr. Vanderhoff.
Hello.
Congratulations on your new appointment.
Well, thank you so much.
There are people who have received the J&J vaccine who are looking to boost their immune system by getting another shot. What are the risks if someone mixes and matches the vaccines? And can you go over those, please? Thank you.
Well, sure, and I'll certainly turn to my colleague, Dr. Burdette, after I make some opening comments, because he is an infectious disease specialist. But the first thing I would say is, look, in public health and in medicine broadly, we're watching very closely the data to get the best indication of whether or not boosters are needed. And thus far, there have really not been indications that, unless you fall into some very narrow categories where the ACIP is actively examining the question, for most people, you don't need a booster. Right now, the data is continuing to show that the vaccines, including J&J, are providing substantial and excellent protection against severe illness with the disease. In fact, there was a recent study within the past weeks released by the folks from J&J that actually showed that over time, they were actually seeing that the effect of the vaccine was enhanced over time, not diminishing. So my best advice would be follow the science and rest assured that when the science and the data tell us that a vaccine is needed, that's your best time to go out and get it. But getting something unnecessarily, it would not be what I'd recommend. But Dr. Burdette, your specialty is in this area, and I'll allow you to go further.
No, I agree with your comments. I think routinely getting a different vaccine after having received the core, one of the EUA approved vaccines here in the United States really is not routinely necessary. I do hear about it in folks who have been vaccinated outside of the United States with some of the vaccines that may not be as effective as we have in the United States. The risk of that is there is an increased risk of injection site reactions and kind of local reactions if you are mixing vaccines. It may augment the efficacy of the non-United States based vaccines. But for J&J, for what we have here in the United States, I would discourage folks from doing that routinely.
Thank you, doctors. Our next question is from David Winter with WKRC.
Yeah, hi, doctors. First of all, in reference to testing, it seems like there is so much emphasis right now on getting vaccinated that the drive-through testing sites and so forth have fallen by the wayside. I personally tried to get a test today to sign up for one, and the closest I could find for a same-day test was 17 miles from my home. Is there any push right now, or is there any effort by the state to increase testing, and is that necessary?
Well, testing continues to play a very, very important role in how we manage through this pandemic at this time. In fact, there was a recent study that came out of the UK looking at the role of testing in their school students, and demonstrating that testing really can provide vital information that can be very useful in that instance in helping to keep children in school. So the answer to your question is, of course, testing remains important, and the Ohio Department of Health continues to support testing and test availability in partnership with a wide variety of entities, including local health departments, some schools, et cetera. I think what we're seeing, though, is a little bit of the supply-demand equation that just happens naturally. As more and more people have gotten vaccinated, and as we saw the numbers of people across the state who were turning positive with COVID-19 drop to very low levels, and I mentioned it was really only a matter of weeks ago that we were all the way down to 17 cases per 100,000 across the state. I think a lot of interest in testing waned, and so therefore a lot of places that were going to a lot of effort to make testing available began pulling back some of those resources. But we are working to help make more testing resources available to more people across the state.
Thank you, Dr. Vanderhoff. Our next question is from Joe Ingles with Ohio Public Radio and TV.
Hello, Dr. Vanderhoff. Thank you very much for doing this, and congratulations on your appointment. My question goes with children. We know that those under 12 cannot be vaccinated at this point. We don't know when they'll be able to be vaccinated. A lot of parents are scared to death because they're sending their kids to school, sometimes in schools that don't require masks, and they don't know what to do to prevent those kids if they do not have a policy there. What should the state be doing? And on the other side, is it possible for the state to break out those numbers that you have on vaccination dashboard so that we know how many kids are 11 and under, and make that bottom level on the dashboard more reflective of what is actually happening?
Well, first, in terms of your last question, thank you for that suggestion, and we will certainly take that back to the team that works on displaying data and information to see if we can provide greater clarity. Our effort has consistently been to offer as much clarity and transparency around vaccination in the state as we possibly can. So we'll take a look at that suggestion. But in terms of what parents should do, again, I'll turn to our schools COVID guidance that we've offered and remind parents that, of course, for those older than 12, vaccination is your best option, provides excellent protection. But we continue to recommend a layered approach to safety in our schools, and that includes masking, certainly, for those who are unvaccinated, and maintaining physical distance, keeping environments clean and well ventilated. And we've communicated that broadly to our school districts and community health leaders. What I'd say to an individual parent is this. You do have very good options available to you, even if your child is less than 12, because we have seen how effective masking is. And there are, in fact, studies of masking that have looked at, do masks protect the wearer, even if an infected patient or individual is not, in fact, themselves wearing a mask? And the answer is yes, they do provide substantial protection there. So there are steps a parent can take, and we've tried to outline those as clearly as we can.
Thank you. Our next question is from Dan DeRose with WOIS.
Good morning and congratulations, Dr. Vanderhoff. This is perhaps to either of you. I'm not asking you to predict the unpredictable, but at 3,400 cases currently, and we're watching this rise on a daily basis, is there any way to see how far this is going to go? Is there any way to get to our peak of 13,000 cases that we saw at the end of November? The layman person would stand back and say, well, that's not possible because we've got 50% of the state's population vaccinated now. What is the limit in your eyes? There has to be some forecasting that's done by ODH on where this could go.
Yeah, predictions, of course, with COVID-19 are very difficult and have been fraught from the beginning. And so one of the things I've learned not to do is rely too much on predictions, but to look at what I'm seeing elsewhere and look at what the experience is in parts of the world and the country that may have preceded us in encountering new waves of the virus. One reassuring thing is that when we look at India and we look at the United Kingdom, who experienced very substantial Delta-driven waves. Those waves did ultimately crest and then begin to come down. Now, the real question is not, will this reach a peak and begin to come down? I'm confident that at some point it will. However, the real question is, how are we doing everything we can together to mitigate how high that peak gets and how severe the experience is? To me, it is tragic anytime we lose anyone in our state from something that a vaccine could have prevented. To me, it's tragic when we have a young, healthy person experience long-term COVID effects from the inflammation that this terrible virus can cause to people's vital organs. And I could go on down the list. So, you know, how high will we reach? I don't know. But I do know that there are steps that we can, and thankfully, as I mentioned at the beginning, are taking as Ohioans to deal with this. We should be masking particularly if we're unvaccinated, and particularly if we are going into a high-risk environment, like an indoor environment or an indoor crowded environment. But beyond that, we should be getting vaccinated. Vaccination is how we will win against this. Dr. Burdette, any additional thoughts, things I may have missed?
Yes. So there has been a lot of discussion about the efficacy of the vaccines with Delta. Okay. And depending on what you read, what you look at, you would think, well, why get the vaccine? Because it's not going to do anything. That is the farthest thing from the truth. New England Journal of Medicine this week published an article, I believe it was based out of Israel, where the Pfizer particular vaccine came in at 88% efficacy specifically against Delta. Now, one vaccine is not enough. One dose of the Pfizer vaccine came in at like 30%. So as Dr. Vanderhoff was saying earlier, you've got to finish the series. So those, Ohioans that have only gotten one dose, you've got to go get the second dose. But I want the people to realize that in the world of vaccines, in the world of infectious diseases, an 88% efficacy is awesome. people used to go get like the shingles vaccine, which was barely 50%. The old shingles vaccine was barely 50% effective. And so for the vaccine to come in at 88%, we got spoiled early on the first 6 months of this year because the COVID vaccine was arguably 99.9% effective in preventing COVID. So it's not quite as good as it was then. But I'll take something that's 88% protection when the alternative is going on a ventilator for which you may never come off. And so I just want the people to realize our vaccine, no matter what people have seen, my personal experience and now the literature specifically looking at Delta, is the vaccine is still effective and highly effective.
Thank you, Dr. Burdette. Our next question is from Chelsea Sick with WKE.
Good morning, doctors. Thanks for taking my question. So schools in the Miami Valley here are starting to reverse masking decisions and now making it mandatory for all students or students not able to get vaccinated. You have said masks work. So why is the state not also mandating masks in schools as we do see COVID-19 cases climb here in Ohio?
Well, that's a question I think we've addressed a number of times. Our role at this time is to put in front of local communities the best guidance and recommendations that we can offer that will provide for both the safety of the community, and in this case, the safety of our students and staff at our schools, along with factoring in those steps that we believe can help assure that students are able to have in-person learning to the greatest extent possible. And I think our guidance really achieves that. But we are relying on parents and communities to look at that guidance, look at that information, and then make the best decisions they can about their community.
Our next question is from Spencer Hickey with Hannon.
Thank you. You talked about the effects of the Delta variant. Can you discuss what that means specifically for young children that aren't yet eligible for the vaccine, particularly given the start of the school year and what that can do with them?
Sure. So as we are examining how Delta works, one of the things that I think we need to recognize is that this is still COVID-19. It is a version of COVID-19 that has various mutations. And essentially what those mutations seem to do is make it much, much more contagious and seems to be able to make people sicker quicker. Now, that obviously has implications for those who are unvaccinated, including those who are less than 12 and currently unvaccinated. But there are two steps that I think, and I'm going to sound a little bit like a broken record here, but there are two steps that we all can and should be taking to protect them. One, if we can be vaccinated, we ought to be, because while, yes, it is true that in rare circumstances, a vaccinated person has been observed to be able to transmit the virus to another person. Those are rare and probably have to do with a brief window of time during which your immune system is, essentially responding to this mucosal virus, a virus that lives in your nose and your throat. The other step, though, is masking. And these, our children can protect themselves through masking. What are the effects that COVID-19 can have? Well, we've shared what those are. They can develop multi-system inflammatory syndrome of children, which is a terrible condition where there is broad inflammation of their blood vessels and organs. Fortunately, our pediatricians are very good at what they do. And after long stays in intensive care units, have had a very good track record of saving those children. But terrible suffering and anxiety for the patient and their family. Other things that we see with COVID-19 with adults can also be observed in children, albeit thankfully, so far throughout this pandemic, at a lower rate than what we see with adults. But they're not Teflon. They're not completely spared from those risks, and I've outlined those before. Dr. Burdette, you're an ID doc. What would you add to that?
No, I think you covered it well. And one of the challenges here is, yes, a majority of folks who do get COVID have mild symptoms. And so everybody kind of notices that. But what I see clinically is it goes through families. And so almost invariably when I see somebody in my ICU or in my step down unit, everybody at home is sick. And the parents of the kids are not vaccinated. So I think that, vaccinating the parents and realizing the downstream effect of that, protecting everybody at the household is going to protect everybody at the household. So vaccinating one or two can make a big difference in what happens in the children.
Yeah, imagine that we were all, those of us who are eligible for vaccine, were all vaccinated. We would be creating essentially a wall of protection around our children less than 12, even as we look forward to the arrival of a vaccine for them as well. So again, vaccination.
Thank you, doctors. Our next question is from Dan Perlman with NBC.
Hi, Dr. Vanderhoff. I want to follow up on the question earlier about testing. As the number of cases continues to rise in the state, do you intend or are there plans to bring back those mass testing sites like we saw earlier in the pandemic?
Well, as you, I'm sure, recall, our testing capabilities were ones that we achieved in partnership with many organizations across the state. The numbers of tests that we're seeing accomplished now in Ohio has continued to rise substantially. But there's no question that we have been engaged with many of our partners around the testing capabilities and what additional steps might be prudent and worthwhile for us to undertake. But make no mistake, when you look at the testing numbers here in the state of Ohio, people are getting tested. And we are seeing substantial numbers of tests being completed.
Thank you, Dr. Vanderhoff. Our next question is from Jim Oddie with WHIO.
This is a question for both doctors here today. Hospitals this week saw pushback on mandatory vaccination for employees. And then on top of that, the House Health Committee is coming back to the State House to consider House Bill 248. This is to prohibit perhaps mandatory vaccination for most other workers. So for both doctors, what is your position and advice at this point? Should employers have the right to require vaccination or not? What do you think?
Well, I'll tell you, there are a couple of considerations here. First, of course, we have been repeating this morning, and I've shared in multiple other press conferences, just how important we as doctors feel vaccination is, and that it is really the best protection we can offer. But, as we look at what our hospitals are doing, I think that we should all be gratified that they continue to demonstrate a profound commitment to our health and safety. Hospitals should be extremely dangerous environments, and yet they're not. And the reason for that is the profound commitment that the doctors, nurses, and administration of our hospitals have to putting patients first. And so, to the extent that hospitals in looking at vaccination are looking at issues of requirements for vaccination, that's a decision they're making at their level. But my reflection as a public health leader in the state is one of gratitude for their commitment to the safety of their patients, and the fact that really what you see is that in the healthcare profession, the patient is put first, and the patient is really the first consideration. Dr. Burdette, I don't know if you would add anything.
Yeah, I'll try to be brief because Jim, you touched on a hot topic for me, and I'm going to stick to healthcare. Okay, number one, within healthcare, it is not new to require a vaccine. Hepatitis B has been required for healthcare workers for a long time. For years now, we've been doing influenza. Okay, we have processes in place for exemptions. So if there is a medical process for a reason that you can't be vaccinated, if there's a religious process or religious reason you cannot be vaccinated, we have that built into the healthcare system for those healthcare workers. But this is a very important thing. I'm sick and tired of losing colleagues. Okay. I'm tired of having doctors die. I'm tired of seeing respiratory therapists die. I'm tired of seeing nurses die. I'm tired of seeing patient care techs and medical assistants die of COVID. Okay. I've lost colleagues. I've lost friends. I've lost peers in this area and across the country. The only way we can stop that from happening is with vaccination. So because we have the processes in place for people who cannot be vaccinated for whatever reason, I have no problem with proceeding because I'm tired of losing my friends.
Thank you both, doctors. Our next question is from Luann Stoya with ABC.
Good afternoon, doctors. Thanks for doing this with us. Look into your crystal ball, wondering how close we are to the peak of this. Do you have any kind of sense of that? It seems like we have continued to ramp up those cases per 100,000 and maybe as much as a 71% increase over the past week or so. So talk about that. And is this the peak, or we have a ways to go?
So yeah, I'll tell you that what we're seeing is in fact what is meant when doctors talk about an exponential rise in cases. And that exponential rise, that rapid increase in the number of people infected with COVID-19 has been observed everywhere that Delta has become dominant. I don't believe that we are at our peak. I believe that we are going to see those numbers continue to increase for some time. I think I would be remiss if I were to say that peak is going to occur at such and such a date. But as I look around at other parts of the globe where this is hit, it is clear that it is something that does peak, and once it hits that peak, generally has declined. However, everything is always new with COVID, and I think that it would be a mistake for any of us to rest on that. Rather, I think what we need to do is focus on what we know works. And that's part of the reason that we are so strongly reiterating the importance of Ohioans getting vaccinated, why we are so strongly encouraging people to wear a mask if you're going into a high-risk indoor situation, particularly if you are unvaccinated. Dr. Burdette, I don't know if I covered it or if there's anything you'd want to add.
Just real brief from a hospital standpoint, we follow the numbers because our peak in the hospital is usually 7 to 10 days after the community peak, because the severity of COVID is not day 1 or day 2 of illness. It's usually in that day 7 to 10 range. So we watch those numbers, and as long as they're going up, we're making preparations to have more places to put people, because our numbers won't go down till a week or two after the community numbers go down.
Thank you, doctors. Our next question is from Justin Dennis with Mahoning Matters.
Good morning, Dr. Vanderhoff, Dr. Burdette. A handful of Ohio universities have not yet decided on mask mandates or decided against them. And given the current state of the pandemic, do you feel this is a non-negotiable item? What do you say to those administrators? If you were in that role in an Ohio university, what factors would you be considering when thinking about a mask mandate?
You know, the fundamental problem, it's a great question, but the challenge for me or Dr. Burdette answering that question is that, of course, we're doctors and we are not in those roles. I'll just reiterate our guidance. Our guidance has been very, very clear. We continue to believe at the Department of Health that the vaccines provide excellent protection, that they are our best guard against this virus. But we also recognize that there are circumstances where even a vaccinated person it might be prudent for them to add a mask. And certainly for those who are unvaccinated, our strong advice is you need to mask, particularly indoors and in crowded environments. Now other things universities have done and should continue to do, include the efforts they've made around ventilation, the efforts they've made to create learning environments that allow more space between people, cleaning of the environment. All those things are good, and I'm confident all those things will continue into this academic year. But in terms of personal safety, those would be our recommendations.
Thank you, Dr. Vanderhoff. We are quickly approaching noon and have time only for 1 to 2 more questions. Our next question is from Marty Schladen with Ohio Cap.
Hi, Dr. Vanderhoff.
Hi.
In your professional opinion, would the best public health course for Ohio right now be to reimpose mask mandates indoors in public spaces?
Well, I think that the reality is that in any health event, in anything that is going on for a long while, and this pandemic has been with us now a long time, we reach a point in the pandemic where we really do need to rely upon the citizenry. We need to rely upon the personal responsibility and judgment of communities and leaders of communities to make the best decisions, but arm them with the tools to do that. That's what we've done. And we will offer any additional guidance or support that those communities may seek from us. But that is our role. And I think we've been very clear on what we would best recommend for those communities.
Thank you, Dr. Vanderhoff. Our next question, and I believe the final question, is from Pete Grieve with Spectrum News.
Thank you. Dr. Vanderhoff, I'm wondering if you can, if you're envisioning sort of challenges for schools as far as contact tracing in those districts where there won't be masks in the fall.
Yeah, excellent question. The Ohio Department of Health has been working for quite some time now with local health departments to provide augmented capabilities around contact tracing. We had those in effect.
Oh, sorry, I hope you're going somewhere cool.
Hello?
Laura, you are.
So anyway, we've had those available and in effect for a number of months. And so we stand ready to continue to provide that support heading into the fall.
Thank you very much, Dr. Vanderhoff. That brings us very close to noon here. Unless you'd like to take any more questions, I believe we will conclude for the day. Do you have any final remarks you'd like to?
What I would like to say is, again, of course, thank you to all of you for your good efforts to get these messages out to the people of our state. Thank you also to the many healthcare professionals who continue to work so diligently, like Dr. Burdette, to care for patients sick with COVID-19 every day. Special thanks to you, Dr. Burdette, for taking time away from your clinical schedule to help us. And again, the plea to every Ohioan who's eligible to be vaccinated, please, if you have not yet been vaccinated, now is the time. Thank you.
Thank you all, and have a